What if those subtle symptoms you've been brushing off as just getting older were actually early red flags of a serious autoimmune disease? Many people chalk up dry eyes, fatigue, or difficulty swallowing to aging, stress, or even side effects from medications. But according to recent clinical studies, these seemingly minor issues could be early indicators of Sjögren's syndrome, a chronic autoimmune condition that affects an estimated 4 million Americans. Even more concerning, it typically takes up to 4 years from the onset of symptoms to receive a proper diagnosis. That's 4 years of discomfort, confusion, and often worsening health, simply because the symptoms mimic everyday problems. Most people have heard of autoimmune diseases like rheumatoid arthritis or lupus, but Sjögren's syndrome, pronounced Sjögren's, is just as prevalent, yet remains widely misunderstood and frequently misdiagnosed. According to the Sjögren's Foundation, this delay in diagnosis can significantly impact a person's quality of life and may lead to serious complications, including irreversible organ damage. So why is it so hard to spot? Because the earliest signs of Sjögren's are deceptively ordinary, often dismissed as part of aging or stress. But catching these warning signs early can dramatically alter your health trajectory. In this video, we'll uncover 8 subtle but critical warning signs of Sjögren's syndrome you should never ignore. But before we dive in, I'd love to know, where are you tuning in from today? Leave a comment below with your city or country. I always enjoy seeing where everyone's watching from. It creates a sense of connection, no matter how far apart we may be. And don't forget to like this video and subscribe for more wellness tips like these. You really don't want to miss what's coming next. Sign number 1, persistent dry eyes. More than just irritation. One of the earliest and most classic symptoms of Sjögren's is chronic eye dryness, medically known as keratoconjunctivitis sicca. But this is not the mild irritation you might get from staring at a screen too long or being exposed to pollen. In Sjögren's, the immune system mistakenly attacks the lacrimal glands, which are responsible for tear production. Tears aren't just for crying. They are essential for eye health. They moisturize, nourish, and protect the surface of your eyes from bacteria and environmental damage. When tear production drops dramatically, you may feel a gritty or sandy sensation, like there's something stuck in your eye. Sensitivity to light, photophobia, which can make being outdoors or in bright rooms extremely uncomfortable. Sticky or dry eyelids, especially in the morning. Fluctuating blurred vision, caused by the unstable tear film that disrupts how your eye focuses light. Over time, this can lead to redness, irritation, and even damage to the cornea. To measure tear production, eye doctors often use the Schirmer's test, where small strips of paper are placed under your eyelids to assess how much moisture your eyes produce in 5 minutes. Sign number 2, dry mouth, a constant, thirsty struggle. The second hallmark symptom of Sjögren's is xerostomia, or persistent dry mouth, and it goes far beyond the need for an occasional glass of water. Sjögren's causes the immune system to attack your salivary glands, severely reducing saliva production. Saliva isn't just for comfort, it plays a vital role in moistening food to make swallowing easier, aiding digestion, enabling speech, protecting against tooth decay and oral infections. Without it, even simple actions like speaking or eating dry foods become difficult. Many patients find themselves constantly sipping water, day and night. Some carry water bottles everywhere just to maintain normal speech or swallow food comfortably. Dry foods like crackers, toast, or rice may become nearly impossible to eat without liquid, drastically altering their diet and enjoyment of food. This dryness also leads to a spike in dental problems such as increased cavities, especially in unusual areas like the roots or gum lines. Oral thrush, a yeast infection, due to reduced antifungal protection in the mouth. Burning mouth syndrome, which causes painful burning sensations, particularly on the tongue. A tongue that looks red, smooth, or cracked, reflecting chronic dehydration of the oral tissues. In fact, dentists are often the first to spot signs of Sjögren's, long before a formal diagnosis, due to the unusual pattern of tooth decay and oral symptoms. These first 2 symptoms, dry eyes and dry mouth, are considered the cornerstones of Sjögren's syndrome, but they are only the beginning. This disease can affect multiple organs, the nervous system, and even increase the risk of lymphoma if left untreated. Recognizing these signs early and getting a proper evaluation from a rheumatologist or immunologist can make a life-changing difference. Sign number 3. Neurological manifestations of Sjögren's syndrome. In addition to the well-known symptoms of dry eyes and dry mouth, Sjögren's syndrome can profoundly affect the nervous system. These neurological complications are often under-recognized, leading to delayed diagnoses and inappropriate treatment strategies. Because the neurological symptoms can mimic those of other conditions, they frequently contribute to diagnostic confusion. One of the most common neurological issues is peripheral neuropathy, which occurs when the peripheral nerves, those outside the brain and spinal cord, are damaged. This typically presents as paresthesias, or abnormal sensations, such as tingling, burning, or numbness. These symptoms usually begin in the extremities, particularly the hands and feet, and often follow a glove and stocking distribution, meaning the symptoms spread upward symmetrically. The intensity of these sensations can vary from mild discomfort to debilitating pain that significantly interferes with daily life. Patients may also experience small fiber neuropathy, a type of nerve damage that affects the smallest, unmyelinated nerve fibers responsible for pain and temperature sensation. This form of neuropathy can cause intense burning pain, heightened sensitivity to temperature changes, and persistent discomfort. Diagnosing small fiber neuropathy is challenging, as standard nerve conduction studies frequently yield normal results. Specialized tests such as skin biopsies or quantitative sensory testing may be needed for confirmation. Beyond sensory issues, cognitive impairments, commonly referred to as brain fog, are frequently reported by patients with Sjögren's. These symptoms include trouble concentrating, short-term memory lapses, mental fatigue, and difficulty finding words during conversation. These cognitive challenges can be particularly distressing, affecting professional productivity, social relationships, and overall quality of life. They are often subtle but persistent, contributing to feelings of frustration and decreased mental clarity. Headaches, especially migraines, are also more prevalent among individuals with Sjögren's syndrome. In more severe cases, Sjögren's can affect the central nervous system, CNS. One serious complication is transverse myelitis, an inflammatory disorder of the spinal cord. This condition can result in muscle weakness, sensory changes, and dysfunction of the bladder or bowel, depending on the level of the spinal cord involved. It requires immediate medical intervention to reduce inflammation and prevent lasting neurological damage. Some patients develop neurological symptoms that closely resemble those seen in multiple sclerosis, MS, including visual disturbances, coordination problems, and motor weakness. Because these symptoms overlap significantly with MS, they may lead to misdiagnosis. In such cases, advanced imaging techniques, such as MRI of the brain and spinal cord, and thorough autoimmune testing are critical to distinguish between the two conditions. Though rare, encephalitis or inflammation of the brain can occur in Sjögren's. This presents with confusion, seizures, behavioral changes, and in severe cases, loss of consciousness. Encephalitis is a medical emergency that often requires hospitalization and the involvement of neurologists with experience in autoimmune diseases. Neurological effects of Sjögren's syndrome are diverse and can range from mild sensory changes to life-threatening central nervous system involvement. Because these symptoms often masquerade as other neurological disorders, heightened awareness among clinicians and patients is essential to ensure timely diagnosis and appropriate management. Sign number 4. Cardiovascular involvement in Sjögren's syndrome. Although Sjögren's syndrome is primarily recognized for its impact on exocrine glands and mucosal surfaces, it also has important implications for cardiovascular health, a connection that is often underappreciated. The chronic, systemic inflammation characteristic of autoimmune diseases like Sjögren's can silently affect the heart and vascular system over time, potentially leading to serious complications if not properly monitored and managed. One significant cardiovascular issue observed in Sjögren's patients is pericarditis, or inflammation of the pericardium, the protective sac that surrounds the heart. Pericarditis typically presents with sharp, stabbing chest pain that may worsen when lying down and improve when sitting up or leaning forward. Some patients describe the pain as knife-like, while others may feel a persistent pressure or discomfort. If untreated, chronic inflammation in this area can lead to pericardial effusion, fluid buildup around the heart, or constrictive pericarditis, which can impair cardiac function. Another concern is the occurrence of arrhythmias, or irregular heart rhythms. These can range from harmless palpitations to more serious disturbances that require medical intervention. Patients often report sensations of a racing heart, tachycardia, skipped beats, or fluttering in the chest. These symptoms may arise without any clear trigger and can be distressing, sometimes causing anxiety or interfering with sleep and daily activities. In certain cases, arrhythmias may necessitate the use of medications such as beta blockers, or more advanced treatments like ablation or pacemaker implantation. Sjögren syndrome also increases the risk of small vessel vasculitis, an inflammatory condition that affects the smallest blood vessels in the body, including those supplying the heart. This can reduce blood flow to the myocardium, heart muscle, and contribute to chest pain, especially during physical exertion. Over time, repeated episodes of inflammation and impaired circulation can lead to permanent tissue damage or even increase the risk of heart attack. Myocarditis, or inflammation of the heart muscle itself, is a rarer but potentially life-threatening complication. It may present with unexplained fatigue, shortness of breath, chest discomfort, or swelling in the legs and ankles, all signs of reduced cardiac efficiency. If left untreated, myocarditis can progress to heart failure, a condition where the heart is no longer able to pump blood effectively to meet the body's needs. Prompt recognition and treatment, often involving corticosteroids or immunosuppressive therapy, are crucial to preserving heart function. Additionally, autonomic dysfunction is a lesser-known cardiovascular complication in Sjögren's. The autonomic nervous system, which controls involuntary bodily functions like heart rate and blood pressure, can be affected by the disease. This may lead to orthostatic hypotension, a sudden drop in blood pressure upon standing, which can cause dizziness, lightheadedness, blurred vision, or even fainting episodes. These symptoms can severely impact mobility and quality of life, and may require adjustments in posture, hydration strategies, or medications like fludrocortisone or midodrine. Another vascular manifestation frequently seen in Sjögren's is Raynaud's phenomenon, a condition marked by sudden episodes of reduced blood flow to the fingers and toes. These attacks are usually triggered by cold or stress and cause the affected areas to turn white, then blue, and finally red as circulation returns. These episodes are often accompanied by pain, numbness, or tingling, and can be particularly uncomfortable in colder climates. In severe or prolonged cases, Raynaud's can lead to skin ulceration or tissue damage. Sign number 5, joint and muscle pain. Joint and muscle pain are among the most frequent yet underappreciated symptoms of Sjögren's disease. Unlike rheumatoid arthritis, where joint erosion is common, Sjögren's typically causes inflammation and discomfort without permanent structural damage to the joints. This absence of visible damage on imaging like X-rays can lead to diagnostic delays or misinterpretation by healthcare providers unfamiliar with the disease. The pain tends to be symmetrical, meaning it affects the same joints on both sides of the body, most notably the small joints of the hands, wrists, knees, and ankles. This symmetrical pattern is a diagnostic clue that suggests systemic inflammation rather than localized injury. Another hallmark is morning stiffness lasting longer than 1 hour, which gradually eases with movement as the day progresses. This stiffness can significantly impact mobility and quality of life, especially when persistent. Muscle pain, known as myalgia, often coexists with joint pain and tends to affect large muscle groups such as the thighs, shoulders, and back. Many patients report a deep, aching discomfort that worsens with activity or after periods of inactivity. In some cases, individuals may develop fibromyalgia-like symptoms, including widespread pain, tenderness at specific points, and heightened sensitivity to touch. These symptoms can be debilitating, leading to sleep disturbances, chronic fatigue, and emotional distress. Laboratory findings can further complicate the picture. Around 60 to 70% of patients with Sjögren's test positive for rheumatoid factor, RF, even in the absence of rheumatoid arthritis. Additionally, inflammatory markers such as erythrocyte sedimentation rate, ESR, and C-reactive protein, CRP, are often elevated, signaling systemic inflammation. Many also struggle with exercise intolerance and post-exertional malaise, where physical activity triggers a disproportionate increase in pain and fatigue. Early recognition of these musculoskeletal symptoms, followed by targeted treatment, including anti-inflammatory medications, physical therapy, and gentle exercise, can drastically improve daily function and overall well-being. Sign number 6, lung disease. Pulmonary complications of Sjögren's disease are more common than previously thought, affecting up to 20% of patients, though they often remain underdiagnosed. Unlike the more visible symptoms such as dry mouth and eyes, lung involvement tends to develop slowly and silently, making early detection more difficult. One of the most severe forms of lung involvement is interstitial lung disease, ILD, which involves inflammation and scarring, fibrosis, of the lung tissue. ILD initially presents with subtle shortness of breath during exertion, a symptom often dismissed as aging, poor fitness, or other benign causes. As the disease progresses, breathing can become more labored even at rest. Another common respiratory issue is bronchiolitis, or inflammation of the small airways, which manifests as a persistent dry cough. This cough is typically unproductive, no mucus, and may worsen at night or in the early morning hours. Conventional cough remedies often fail to relieve the symptoms, which can cause considerable distress. Sjögren's also compromises the airway's natural defenses, increasing susceptibility to recurrent respiratory infections like bronchitis or pneumonia. Some patients develop pleurisy, an inflammation of the pleural lining around the lungs. This causes sharp, stabbing chest pain that worsens with deep breaths or coughing and may radiate to the shoulder or upper back. Pulmonary function tests, PFTs, often reveal a restrictive pattern, meaning that the lungs cannot fully expand to take in air. Even mild reductions in lung capacity should prompt regular follow-up, as lung function can deteriorate over time. High-resolution CT scans can detect early lung changes not visible on chest X-rays. These scans help identify specific ILD patterns, such as nonspecific interstitial pneumonia, NSIP, or lymphocytic interstitial pneumonitis, LIP, guiding diagnosis and treatment planning. Early diagnosis of lung involvement allows for timely intervention using corticosteroids, immunosuppressants, or other therapies to slow progression and preserve respiratory health. Sign number 7, kidney dysfunction. Kidney involvement in Sjögren's disease, though often overlooked, can have a profound impact on health and quality of life. The most frequent renal complication is interstitial nephritis, which is inflammation of the tissue between the kidney's filtering units. This condition can develop silently, showing no clear symptoms until significant kidney damage has already occurred. Routine lab tests, such as urinalysis and blood panels, may reveal subtle signs like mild proteinuria, protein in the urine, or changes in creatinine levels before clinical symptoms emerge. One early symptom many patients report is nocturia, or frequent urination at night. This disrupts sleep and contributes to fatigue and cognitive impairment, which are already common in Sjögren's. A more serious complication is renal tubular acidosis, RTA, where the kidneys lose their ability to properly regulate the body's acid-base balance. Symptoms include muscle weakness, chronic fatigue, and a tendency to develop kidney stones. In advanced cases, electrolyte imbalances, especially low potassium, may lead to irregular heart rhythms, a potentially life-threatening issue if left untreated. Some patients also develop nephrogenic diabetes insipidus, a condition where the kidneys become resistant to antidiuretic hormone, ADH. This results in excessive urination and intense thirst, which can worsen the hallmark symptoms of dry mouth and dehydration associated with Sjögren's. Proteinuria serves as a crucial biomarker for assessing kidney involvement. Detecting it early allows for interventions, such as immunosuppressive therapy or ACE inhibitors, that can slow or even halt the progression of kidney damage. Monitoring kidney function regularly is essential, especially since early renal symptoms are easy to miss and can quietly lead to chronic kidney disease or systemic complications if not addressed. Sign number 8. Hematologic, blood-related manifestations. Hematologic abnormalities are a significant, yet often underappreciated aspect of Sjögren's disease, offering vital diagnostic clues and revealing complications that may require ongoing monitoring and targeted treatment. These blood-related manifestations can range from subtle laboratory anomalies to serious conditions that impact overall health, immune function, and even survival. One of the most common blood-related findings is anemia of chronic disease. Unlike iron deficiency anemia, which results from a lack of dietary iron or blood loss. Anemia of chronic disease is caused by long-term inflammation. In Sjögren's, chronic immune activation interferes with red blood cell production in the bone marrow and shortens the lifespan of existing red cells. Patients may experience fatigue, pallor, weakness, or shortness of breath, even if iron levels appear normal. Leukopenia, or a low white blood cell count, is another frequent hematologic issue, often involving neutropenia, a deficiency in neutrophils, the primary defenders against bacterial infections. This can make individuals with Sjögren's more prone to recurrent or severe infections, especially of the respiratory or urinary tract. A smaller but important subset of patients may develop thrombocytopenia, a condition marked by a reduced platelet count. Platelets are essential for normal blood clotting, and their deficiency can lead to easy bruising, nosebleeds, prolonged bleeding after minor cuts, or, if severe, spontaneous internal bleeding, which requires urgent medical attention. Another hallmark blood abnormality in Sjögren's is hypergammaglobulinemia, a condition in which the blood contains elevated levels of immunoglobulins, antibodies. This reflects the overactive immune system typical of Sjögren's, where the body produces excessive antibodies, many of which are not targeted at infections, but rather at the body's own tissues. These abnormal antibodies can be detected through specialized tests and often help confirm the diagnosis. Perhaps the most serious hematologic risk associated with Sjögren's is an increased likelihood of developing non-Hodgkin lymphoma, particularly malt lymphoma, mucosa-associated lymphoid tissue lymphoma. Studies suggest that people with Sjögren's are 14 to 44 times more likely to develop lymphoma than the general population. Warning signs include persistent, painless swelling of the salivary or lacrimal glands, unexplained weight loss, fevers, night sweats, and enlarged lymph nodes. Any of these should prompt immediate medical evaluation. In addition, some patients with Sjögren's may develop antiphospholipid syndrome, APS, a condition in which the immune system produces antibodies that mistakenly increase the risk of abnormal blood clotting. APS can lead to deep vein thrombosis, DVT, pulmonary embolism, strokes, or pregnancy complications, including miscarriage and preeclampsia. Given these potential complications, routine blood tests, including complete blood counts, markers of inflammation, immunoglobulin levels, and antibody panels, are essential for the early detection and management of hematologic issues in Sjögren's disease. Proactive monitoring allows healthcare providers to initiate timely interventions, reduce risks, and improve both short and long-term outcomes. If you found this video helpful, don't forget to like, share, and subscribe. Your support helps us spread awareness about often overlooked health conditions like Sjögren's disease. Have you or someone you know experienced symptoms like unexplained fatigue, joint pain, or nerve issues? Let us know in the comments. We're building a community of support and information. Be sure to check out our other videos on this channel. Knowledge is power, and in the case of autoimmune diseases, it could be life-saving. Stay informed, stay proactive, and take care of your health.